for taking time out of your schedules on a Saturday to be here with us today for our webinar, Caring Across Distances, Managing the Health of Our Parents and Elders in India. Today, we'll explore a range of topics, such as taking care of our parents even when we're not with them, the growing need for elderly care in India, and how, with the help of technology, you can have peace of mind and stay updated on every health parameter. We'll also dive into what we here at Family Pro Health can provide to you. Joining us today are two distinguished experts, Mr. Vimal Shukla and Dr. Sanjay Singh. They will provide informative insights into the topics as mentioned earlier. Mr. Vimal Shukla is one of the founding members of Family Pro Health and has a remarkable career spanning several senior management roles in various sectors from retail to healthcare. He leads teams globally and has a track record for creating innovative strategies for market expansion and working with startups. Dr. Sanjay Singh is a board certified in neurology and is known for his pioneering efforts in neuroscience. He continues to inspire the future generation of physicians and spends some of his free time in free medical camps in India. Before we begin this webinar, I would like our audience to keep just a couple of things in mind. We would like you to keep your microphones on mute. Should you have any questions during the webinar, please put them down in the Q&A box and they will be addressed in the Q&A session that we have prepared towards the end of this hour. We'll give you a minute to do so.
Okay, thanks, Pranati. And hello, everyone. Good morning, good afternoon. Welcome to this webinar, and thanks for giving us the opportunity on your weekend to share our thoughts on how we can take care of our parents and other loved ones, even while we are not staying with them. Today, first, we are going to get a physician's perspective on why monitoring of some basic health parameters are important and how we can get some early warning signs by regular health monitoring for our parents. Then we will talk about the role the technology has to play to help us in this issue, and followed by a solution demo of what we have to offer. And then we will talk about some exciting new offers that we have brought for you today. So, we want to share some, offer you some pretty good deals that will excite you as well as incentivize you to do something about your parents' health. And lastly, we'll spend some time on the Q&A. So please feel free to submit your questions on the portal, and we'll take them up at the end. Dr. Sanjay and I, we both moved to the US from India, like a lot of you on the call today, and for, of course, better career options. And of late, this has been the trend across the globe. People move out of their city, between states, within country, out of country for better job opportunities. Now, when this happens, then the question at the back of our mind is, how do we take care of our parents and from wherever we are? So this takes the form of either, calling them every day, every week, checking on them, sometimes having them relocate from their primary place of residence to stay with us, or make some alternative arrangements for them to wherever they are. And all good things. And, more and more, but we are seeing that the parents are resisting the move to come and stay with us. As an example, my mom is in India, and I worry a lot about her health. And some days she will call me. In fact, it happened today morning that she is not feeling well. And my attempts to get her to a doctor are futile, because there's always a reason for not going to a doctor or have somebody come and visit her as well. Giving reasons like weather is bad or my maidservant has not come, and so on, right? So, and I'm always left scratching my head trying to figure out what should I do. Should I just catch a flight and go there? Not that I don't have a support structure there of my cousins, but you can't be calling them for every time something happens like this. And quite a few of us are in the similar situation. And my friends and we have been discussing this, and trying to figure out, look for a solution on what we can do about this. And we have concluded that first and foremost, the important thing is to get the right data about our parents' health. So if my mom calls and tells me something is wrong, I should know what exactly, whether it's a blood pressure that's she is having, or she's, a lot of times in India you have virals, flu or something. So is that what it is? So right now, we think that, getting the right data, right, getting it in near real time is the most important thing. And then, the question is, how do we get that data? So we should have a process in place. We should have some devices in place where it will be easy for our parents to take the readings, and then we should get those data points almost instantaneously. Moreover, we should be able to share that data with our other family members. So, for example, in my case, my brother and sister, they should also be able to get a copy of the data in near real time. So whoever is seeing it first can call my mom in this case and take care of it. So that again became a requirement for us. And we did some surveys talking to people like us, my friends and family members, as well as my own mom and other parents and seniors in India, trying to figure out what is the best way to solve this problem of getting the data, first of all. And then how can we come up with a process that makes it easy for them to take this data as well? So today's webinar will focus on this. And the main thing is that we don't want to get a call in the middle of the night, saying something is drastically wrong, right? So is there a way where we can take care of our loved ones, and we can do this from wherever we are globally? So as Pranati mentioned, Dr. Sanjay is here today with us. He has seen this problem firsthand. He has been working with setting up many medical camps in India that he regularly organizes as well. And he will provide us today a physician's perspective on why it is important to have the data, what kind of data should be monitored, how frequently they should be monitored, and how can we take some preventive actions even when we are not staying with them. So let's first hear him out, and then we will discuss what is the solution we have come up with and how we can collectively solve this problem. So Dr. Sanjay, over to you, please.
Great. Thank you, Vimal, and welcome to this webinar. I think it's important for people who have families living in India or people who have loved ones over there. So clearly, the population is aging across the world and also in India. And those numbers are slated to double, if not triple, in the next few decades. Fortunately, there's high life expectancy now in India, and so our parents and loved ones are living longer. And the issue really is that we have moved there from joint families to unit families, and so there is the issue of how do you take care of your parents and loved ones. I'm going to focus on just a few things, and that's why we have chosen to monitor a few vital parameters, medical parameters. So let's look at diabetes. And this was a recent medical study that showed that across India, 101 million people have diabetes, right? And then the pre-diabetic, that means those who are at risk for developing diabetes, it's 136 million people. Now, those who have diabetes, it is important that they find out at an appropriate time and then they manage their blood sugars well, because this will determine their future course of health. So this is really, really vital that they manage their diabetes well. And for that, they will need to monitor their blood sugar and other health parameters regularly. The second thing I did want to touch upon is high blood pressure. This is something I have to say we were not aware of how widespread this was in India till very recently. And now we are learning that about 33% in urban centers and 25% in rural areas, people are hypertensive. And a significant number of these people are not aware, because really, you could have silent disease, which I call silent killers, because these disorders, diabetes, high blood pressure, and other such disorders can really lead to very serious illnesses, which could be preventable if we manage these vital parameters like blood sugar and blood pressure really well. Next slide. So let's look at the first one over here. and look at this, what can diabetes cause? So it can cause a stroke. What is a stroke? Stroke is when one region of your brain, doesn't get enough blood supply, and so dies off. And that can result in paralysis in one half of your body, loss of the ability to speak, loss of vision. So really debilitating disorders can be caused by uncontrolled diabetes. Heart disease like heart attacks and heart failure, kidney disease where kidneys could fail and you might need dialysis, for proper treatment. It can affect your nerves in your legs and your arms, so you can have numbness, tingling, pain over there. It can affect your vision, your dental health. It can also affect the blood vessels that supply blood to your extremities, like your legs and arms. And sometimes in more serious disorders, if this is neglected, then that foot or that toes would need amputation because they are dead from lack of blood supply. So proper management of diabetes and your blood sugar is very, very important. And again, even in diabetes, particularly pre-diabetes, a significant number of people are unaware that they even have it. So they have not even measured this ever in their life, and that's why they're unaware. And it is slightly different in India as compared to the United States, because here, we have our annual physical, or at least we should have our annual physical exams with our physicians. But in India, there is no such thing. So unless you're actually going for an actual annual physical, the physician may not feel the need to address this issues like diabetes and high blood pressure. Next slide. So what about high blood pressure? So this is, a really important thing for us to understand. What can it cause? So it can cause a stroke, like I said, paralysis, loss of ability to speak, loss of ability to see, really causing a lot of debilitation and morbidity. It can cause a heart attack. It can cause heart failure, vision loss, kidney disease. So all of these kinds of things can be caused by high blood pressure. And so researchers, have found that you have two values in blood pressure. The systolic blood pressure, which is the higher number, and then the diastolic blood pressure, which is the lower number, right? If your higher systolic blood pressure is high, that is above 130, there's about a 36% increased risk of stroke and heart attack and heart failure. If the lower number, the diastolic number, is high, above 80 or 89, then the risk is about 32%, right? And for people who have both systolic and diastolic measurements are high, then their risk goes up to 67%. So it is really, really important, A, that we measure our blood pressure regularly, and B, that we manage it really well. Because if you look at the number of people who have high blood pressure, first, there's a significant number of people who don't know that they have high blood pressure because they've not been regularly measuring their blood pressure. That's number one. Number two, even if they know that they have high blood pressure, a significant number of them, their high blood pressure is not adequately controlled. So we are not getting the benefits that we should of managing blood pressure. So that is why it is important. And when you go to your physician to manage your blood pressure, she or he, your physician, your parent's physician, your loved one's physician, would really like a measure of how your blood pressure has done over the last several days to several weeks, right? So that they can base their treatment decisions on good data. But they don't have good data. They just measure your blood pressure when you go to their office. And you can have something called white coat hypertension. You're going to a doctor's office, you have anxiety, and your blood pressure could be high. So they don't have the right data to really determine your treatments through that. Next slide. So with your blood pressure, if we could treat your blood pressure adequately, it actually decreases your chances of a stroke, which means paralysis or loss of vision or loss of speech, by more than 1/3, 36% decrease in the incidence of stroke. And there's similar benefit in heart disease too, which are the two big killers in the older age range, right? In terms of diabetes, if you manage your blood sugars well, it reduces the risk of heart attacks by 2 to 3 times. So that is really important and an effective measure of reducing these diseases. So the idea is that we want our loved ones, our parents, to not have to have a stroke or heart disease, which can be very debilitating for them and then very concerning for their children here. And that can be prevented if we manage these vital parameters well, like blood sugar and blood pressure. There's also the rationale to measure your oxygen saturation. Everyone became very knowledgeable about this issue, particularly during the COVID times. But people who have lung disease or heart disease, really oxygen saturation is important. Also, monitoring your heart rate or your pulse rate and the rhythm there is important because you can have a lot of heart rhythm disorders, and that is important to detect early. One of them is called atrial fibrillation or AFib, and that is when you get irregular heart rate. And what happens then is that it allows clots to form in your heart, and then those clots are sent to your brain to cause strokes. So really, it is important to have a good idea about how whether someone has it, because these things can then be treated. Temperature, measuring temperature, it's a vital sign, and it's a good early detection of illness. So if someone has a temperature that is high, has a fever, that means there's some kind of infection that is probably going on. And in the elderly, especially in elderly women, there's a high incidence of urinary tract infections and stuff. And so it's really a very vital measure that can give you and their physician good data through this. And then measuring your weight, because obesity is an epidemic around the world, also now in India, right? And obesity or too much weight can be a very big risk factor for heart disease, for stroke, for high blood pressure, type 2 diabetes, especially obesity around the abdomen can be a big risk factor for serious illnesses that one can have. Also in patients who've got heart failure, whose hearts are not working, if their weight is going up, that means they are about to have a major worsening of their heart failure, and they may require hospital admission. But if we can detect that the weight is going up slowly, then you can treat that and prevent that hospitalization that may be happening. So clearly, measuring these vital parameters is tremendously important in keeping our parents and loved ones healthy, right? And as you were told, there'll be an opportunity to ask questions at the end, and I'll be happy to tackle any medical questions that you may have. I'm going to hand this back to Vimal, and he will walk you through the solution that has been created.
Thanks, Dr. Sanjay. Now that we have his perspective on why and what we can do about this, let us take a look at the role technology has to play to help us solve this problem. In the last decade or so, we have seen a lot of innovation in new technologies, and hence new devices have been launched to help us gather the data. These can be categorized in 3 main buckets shown on the left-hand side of your screen. The medical devices, which can be used on the go, or you can use them at home. Wearables like smartwatches and patches, which you can wear them continuously or a certain period of time. And then the medical alert systems, which allow users to call for emergency help whenever one requires one. But some of these things, when we did the survey, we found that they have not gained general acceptance, and it has been low, specifically for seniors and elder care population, due to some of the reasons we found listed here. Some find it complicated to operate. Some others have difficulty in wearing them continuously, especially in the Indian climate where people perspire a lot. Some of these devices work individually, but it's very difficult to get a common dashboard. So now if you are trying to share all the parameters with your caregiver or your physician, you have to now either download the data in different formats and different places, and then try to combine them together. It becomes very cumbersome. Some of these devices do not allow data to be shared with family members and caregivers, privacy concerns. Parents are also afraid of the high cost of some of these devices, and they fear that they may lose them, or some things, if they may misplace them. And most important, quite a few of these devices are not FDA or government approved, so the validity of the data is quite a lot of times questionable. When you go to the doctor, they don't want to rely on some of this data as well. So we basically we're trying to figure out, okay, how can we solve this, given these constraints, and we have come up with a simple solution, keeping in mind the seniors and elders. So in our solution, we are the subscribers. So people, kids, and us who are on the call, we are all subscribers, and we have the control to initiate the process, first of all, to take care of our parents. And how do we do that? We go to the Family Pro Health website, we sign up for the solution, and the parents are now the beneficiaries, as in our definition. So we set up everything and on the portal, and when the parents get the devices, they download the app, and then everything is pre-configured for them. So the way we have done this is we have looked at devices which are known to this age group as reliable. So they have seen, all of our parents have seen blood pressure monitors and pulse oximeters and weighing scales. So they are actually very comfortable using some of these devices, right? We are not giving them a new device which they may find difficult to use. There's no need to wear some of these devices continuously, and you can use it as needed or based on the doctor's advice. They're easy to set up and operate. Anybody can do that. And there's one dashboard to report for all the parameters using our solution. And as subscribers, we can set up the schedules and thresholds, and basically decide when should we get an alert, and what is the parameter exceed level or the threshold that should prompt an alert. So we have the flexibility of doing that as well. We also have the flexibility of sharing the data with family members and other caregivers. So based on some of these things, we have come up with a solution, and let me jump over and show you how the solution actually works. So give me a second here while I open the demo. We are going to show the salient features using two personas today, that of a subscriber and then of a beneficiary. We also have a persona called family members. We are not going to cover that today, but that is basically for the people who you want to add so they can get the readings as well. A subscriber is someone who describes to the solution, and typically this is the person who signs up for the solution by going to our website. He has the ability to select the beneficiaries and the family members on the portal. A beneficiary is a person who is going to take the readings. In most cases, this will be our parents, but the subscriber can decide who else can be a beneficiary. As an example, a subscriber can decide to nominate his uncle or aunt or somebody else as beneficiaries as well. Let me start a demo of what features are available to the subscribers and how easy it is for them to use it. On the screen, you see the homepage of a subscriber. In this case, it's an iPhone. Once a subscriber has signed up for the solution, he will get a text message with a link to download the app, FamHealth app. Here I see on the bottom right, there's a FamHealth app. So let me just open it here. And you can see that the subscriber has two beneficiaries listed here on the homepage, my father and my mother, and these are the two personas that he subscribed them for. Let's select my father here. So on the top, you will see the health parameters for my father. So these are five parameters that I have subscribed for my father. So here, if I tap on blood pressure, I can see the last reading that my father has taken and the date and time. Similarly, if I see the pulse oximeter, I can see that as well. So this basically gives me a way to get the last reading that was taken by my father. Now, if I want to see some kind of historical trends, so let's say I go back to blood pressure and I want to see the trends. So here, if once I select history, I can see his blood pressure parameters. And as you can see, date-wise, he has not been doing that great. Um Especially the red ones, you can see that his readings have been pretty high consistently. And this tells me that I need to be a little worried about his current medication. Maybe it's not working, or it needs to be changed, or maybe he's not taking them regularly, right? So this is very easily, I know I can see the trend and I can see what's going on. Let's see a pulse oximeter history as well. Here, this seems to be okay. And historically also, I can see that, he's doing pretty okay here. Now, there is another way to look at the history for my father and my mother here as well. And this at the bottom, you can see there is something called home report and account. So let's click on report and let's select my father's reports. So here you can see that I can check for his last 7 days, 30 days, or 90 days of reports. So I can select 90 days, let's say. Now I get an option at the bottom asking me to share or download. And now I can share the readings as in a report form with anybody I choose to. And once I select share, I get a message that I'm now choosing to share the report, and I'm providing my explicit consent to view the information. And let's say I say okay. Now again, remember that's very important because from data privacy perspective, we want to be sure that data is not being sent to somebody that we don't want to. So the person who's sharing the report owns the content sharing. Now, since I selected share, I'll go back and let's say I want to select WhatsApp. So I can now select the name of the person who I want to share the report on WhatsApp. So let's say I select myself here and then I say send. So now the report has actually gone out as a WhatsApp to the person I selected, in this case myself. And similarly, we can send it through an email or a text message or any other form that we would want to look at, right? Now the report also has, this was one way to share, but there's also a feature where I can download the report here. So again, I'm downloading the 90 days report and it will take a few seconds, and depending on the internet connection and the amount of data that has to be transmitted, it will take some time. So report has been downloaded. Let me share with you what kind of report comes out, and this is the same report that will go on WhatsApp as well in this other case that I showed you. So on the top, my father's details. First, I see a summary of the parameters. So all the parameters are listed here. How many readings were taken during the period? So in the last 90 days. In range readings, how many of them? Readings that were above range. So, typically I can see that blood pressure, typically my dad has been above range most of the time. It also shows in red, with the readings which were highest. So in this case, 156, 133 became the highest here. And of course, the lowest reading value here. Now, if you go down the report, it now gives you the daily summary of the readings that were taken month-wise and day-wise for all the parameters. Now, this is important because all the health parameters are now available in one report. And if we are sharing it with a caregiver, then he can view all the parameters on their own mobile devices. And this actually helps us tremendously because when we are consulting with the doctor or for any kind of telemedicine or even with caregivers, this is a good feature to have. Now let's see what other features are available on the account page. Going back here. Here there are two important features that I would like to show you. Of course, in the profile settings, we can set up our own profiles and edit them and change the password, etc. But important thing I want to show you is managing the schedule. So I can select manage schedule. I go and select for my father. So here I can see that my father has two schedules that are set up here. In the morning, he is required to take his blood sugar reading between 5 a.m. and 12 p.m. And it says here, please take blood sugar reading before eating anything. So what this does is this keeps a track whether my father has taken his blood sugar reading uh, regularly or not. And if he's missing anything, then I'll get a text message and he will get a text message reminder saying that he has not taken this. And in the afternoon here at the bottom, you can see the other remaining four parameters are showing up and do the message that once he gets up after his afternoon siesta, he's supposed to take these four. Again, if he misses it, a reminder goes out to him that he has missed it and he should be taking it as soon as possible. And I also, get a alert or a notification letting me know that he has missed the reading. Especially important is once he misses it, let's say 2 or 3 days continuously, then tells me something is definitely wrong. So I can then call him up and find out what's going on. Now let's just show you how easy it is to set up a schedule. So let's say I want to set up a new schedule here. So I just say add schedule. And since we already have one for morning and afternoon, let me uh, add one for before bed. Let's say I want him to measure his pulse oximeter before he goes to bed. Date range, let's select from tomorrow and for 1 week. So let's say, I know he's having any issues with pulse oximeter and I want to measure this on a temporary basis. So I can set this up with some optional instructions if I want, and I save it here. That's it. So we are now able to set up a schedule for my father to take his pulse oximeter reading just before going to bed. Now, another important feature I want to show you here is the threshold readings for the readings. And the thresholds provide a way to manage alert and notifications. So if the readings are higher or lower than the threshold set, then I get an instantaneous near real-time alerts about them. Now, the system comes with some default readings that are set up initially, but this can be changed. So for example, if I know my dad typically has a high blood pressure of, like you saw, 150, and I want, um, and of course, in consultation with my physician, say that I want to get an alert if it is more than 125. So I have the flexibility to do that, right? Same thing for high as well, for systolic 125 and diastolic as well. Similarly for temperature and for pulse oximeter, blood glucose. So I can change some of these parameters, and what this does is it provides a way to get an alert and something. This is the way that the system uses to send alerts and notifications, and we get it in real time. Let me just show you how the notifications come. So if I go to the alerts, so you can see that here at the bottom the threshold exceeded. So my father had taken a reading today morning, 55 minutes back, and the biometric reading taken was exceeding the threshold limits. So I do get a threshold exceed as a notification within the app as well. And I also would get an email. So the one that I showed you here, you can see that an email also came to me on my email as showing me the readings as well as telling me that the default is 120. So defined threshold is 120/90, but the reading that was taken was 140/85. That's pretty high, right? Similarly, if I have set up a notification which also informs me that a particular reading has not been taken. So in this case, an email came saying that that my father has not taken the reading for the last 3 consecutive days. So this kind of notifications come on an email as well as on the notification as well. Let me now change and show you how things work out on beneficiary's phone. I'm going to change my phone to my father's phone here. Give me a minute. Okay. So now you can see my father's Android phone, and this is my father's phone here. And remember, the app knows if you are a subscriber or a beneficiary based on your login credentials, right? So in this case, now let me start my app, and you will see that uh, some features are different for my father here. So when I open it up, in this case, I got a message that my father has not set up the blood glucose monitoring, so I just cancel it. So this is the home screen, and you can see, as on the home screen, he has all the 5 basic parameters that I've subscribed him for, and available in large fonts and in large icons. So it's very easy for him to see them, and then he can press any one of these to take the reading or check his readings. But before I go there, let me first show you on the account what things that are available to my father here. Under profile settings, he can of course edit his profile, but the one that I want to show you is notification settings. So if he wants to enable voice instructions for taking a reading, he can do that. And also if the temperature he wants to look at in centigrade, then he can save that. And I'm going back, it has been saved. Okay. Of course, the other two are terms of use and privacy policy, pretty standard things. But the other important thing I want to show you here is the biometric data permission, right? So these are the 4 personas I had set for my father to receive his data. My wife, my younger daughter, my elder daughter, and my subscriber account. This is my account. Now here, my father has the flexibility of allowing selecting people with whom the data he wants to share. So let's say he wants to share the data with all of us. So he can select this. And if he decides not to share, then also he has the flexibility. So again, from data privacy perspective, this is important because he is now providing his consent to share his health parameter data with the people that he chooses to. So I save it here. Okay. And let me go back to the home screen. And those are the 2 things that I wanted to show you there. Now let me take some live readings here, and let me show you how these things work. So let's say I want to take the pulse oximeter reading, and I'm now uh, playing the role of my father here. So again, on the top, on the first page, we see the last reading that I had taken as my father. And of course, the same thing, that was available in subscriber phone. The historical trend is also available. But here on the bottom, there is something which was not on the subscriber phone, which is a take reading. So here you can see I'm taking a reading on your screen. I'm showing you, and I'm taking the plus take reading here, and all I do is put my finger inside the pulse oximeter, and the reading will now come up. So as soon as the reading comes up, reading gets recorded, and you can see that I did great in terms of my blood pulse oximeter reading. Sorry. Now let me show you another reading. This was normal, so no notification went out, I think, for this one. But let me first now try to show you how a blood pressure reading would work. So here I am putting the blood pressure monitor on my arm, and I go and look at blood pressure and take reading again. So again, you can see that, and earlier you saw that there was a voice notification that came, but here you can also see that there are some visual instructions also provided to help them how to take the reading. So it's all very simply provided here, and if something is not right, then they can always refer to this. Now, while the reading has been taken, let me show you the feature at the bottom. Of course, home screen is the home screen for the parameters. View schedule, I'll just show you one. Reporting is the same thing that we saw in the subscriber phone, where he can again see his report, as well as he can share the report with the people that he wants to look at. And of course, I went to the account setting, and that was already provided. So now here you can see that the reading has been taken. Of course, it's come, it's come very high. 156,102 is very high. So something is not right with my readings today. And so this since the reading is high, I'm pretty sure that it has a notification has come to me, and I'll show you that. Now under view schedule, you can see that now I have a new schedule which I added on the subscriber phone. So before bed, 8 p.m. to 11 p.m. is also now coming up for the pulse oximeter. So I can see that my son has actually added a schedule here, and I can view it here. So this was on the father's app, on my beneficiary app. This is what I wanted to show you as part of the personas, and how easy it is for us to take the biometric readings. You can see your last reading, you can see the history, you can see the trends, you can get notifications. And of course, one thing I did not show you is that if the phone is not working or not connected to the network, then there's an offline mode, so you can still take the reading, and the readings will be sent to the cloud as soon as the data connection becomes available. So with that, that was the demo of the solution. Okay, so you saw how easy it is to take the reading, but let me just show you. There was a question that came to us where people have been asking us about any kind of customer support that's available, or is it a visual depiction of how the readings have to be taken. So we do have a YouTube page. There are a lot of videos here, and I'll just take a few seconds and show you, how easy it is to follow this and take the readings here.
How to take pulse oximeter reading using the Fam Health app. Make sure that Bluetooth is turned on. Place your finger in the pulse oximeter as shown in the photo. Tap on the Fam Health icon to open the app. Tap on pulse oximeter. Tap on take reading. Press the start button indicated in the photo. The reading will appear on the app momentarily.
So that was pulse oximeter, but we also have the blood pressure
How to
and
take temperature.
temperature and others as well on
How
the
to
website.
take
So
weight reading.
our parents can take a look at some of these, and they can again use these as tools to take the readings themselves. So let me go back to the presentation, and just wanted to talk a few more things before we start talking about the offer. And okay. So the next thing I wanted to show you is, the devices themselves. I told you they are very easy to use, and we actually went and talked to quite a few device manufacturers, and we selected right now the BPL as well as the Roche as the two companies where we are providing the devices from. Very high-end devices, simple to use and very robust. Have been in the industry for quite a bit of time. The solution itself, as you saw, is available on iPhone as well as on Android phones. These are the two mobile devices that are the most commonly used across the globe. And I want to talk a little bit about our solution. I think I mentioned it's currently launched in 20 plus countries, and people have been using it for some time now, and we have gotten very good feedback from them. On the left here, Suresh and Meena Prabhu, their son Sujit had subscribed for the solution, and when he did this, he was not aware that his dad had been having a high blood pressure issue, and he was under the impression that since his father has been taking the medication, everything was fine. But when he started getting daily updates on his phone about his dad's readings, then it was on a very critical phase, and it was almost like 170 plus. And he, upon checking it for a couple of days, he immediately arranged for a doctor visit, and then they found out that the medication was not working the way it should have been. And just last week, he called me to thank again that, because of our solution, he was able to know. Otherwise, his doctor, his father's next doctor visit was only scheduled 3 or 4 months later, and anything could have happened. So that's one scenario. Then the other one is Dr. Malvi on the right. He's a retired doctor, and he has been taking his BP and pulse reading pretty religiously for the last 15 years. But he's been writing it down manually in his diary. And whenever he goes to visit his doctor, he has to take his diary and then show it to the doctor. And it's very cumbersome and manual process. But now, after subscribing to the solution, so his daughter did that. And now he is able to record it on his phone without any problems. Very, very smooth process. And he's now able to share the readings with his doctor as well on WhatsApp. And he's a big proponent of video consultation as well as telemedicine and all of those new things. So, and on top of that, he's also very happy that his daughters are now getting a copy of the readings as well. So if something is not right with him, he knows that one of them will definitely give him a call if some of the readings are not right. So again, there are a lot more people who have been using it. So, and we have been getting good feedback about the solution, and very happy that they are able to see their parents' readings. Now, let me talk about the special offer for you today. This is something only for you on the call. For one-time payment of US dollar 112 or Indian rupees 9,200, you get 3 devices: the blood pressure monitor, glucometer, and the thermometer, or Bluetooth enabled from the company I just talked about. These are 20 to 35% discounted from the market prices today. And not only this, you will also get 3 months of subscription free from us to monitor the health of your parents' data. And this pricing includes free shipping, and it also includes the taxes. And for availing this offer, please use the coupon code listed here, webinar 2024. We also have our customer support team in India, so you can reach out to them on the toll-free number or also on WhatsApp for any kind of issues that you may run into. Subscription will continue after 3 months for $7.49 per parent, or 600 rupees a month. So just for a small amount of money, you will now be able to get readings of your parents' health, and then you can act on it. And if for some reason you're not happy with some features, functionalities, and you want to terminate the contract, fine. You can do that anytime you want. No questions asked, and you can still keep the devices. So the devices that we have given you already on discounted pricing, you would continue to keep that. Now, one of the things that after we launched that, people have been asking us is, yes, we have the data, but is there something you can do to help us out to how to use the data? So yes, I know my father needs to visit a physician, and maybe he needs some other nursing services. So is there something you guys can also provide? So we have tied up with multiple partners, and one of such partner is listed on the slide, Vesta Elder Care. They provide nursing services, critical care, home diagnostics, e-consultations, and health tracking. So you can directly reach out to them on the contact details listed here, or you can reach out to us as well. And if you decide to subscribe to the solution using the coupon code that we had given, and Vesta is actually offering you as well a free weekly home visit by a care manager for the first 5 signups. So please try to avail this offer. So for 3 months, you are not only going to get free monitoring, but also a free weekly home visit by a specialized healthcare provider. And this is for Delhi and NCR region right now. But Vesta is also in other cities as well, and we can talk about that. Again, this is a way for us to extend and help you uh, utilize the data. Similarly, we have tied up with Emoha as well, a very renowned company in multiple cities in India. Similar to Vesta, they also provide nursing and caretaker home services and ambulance services, and you can also do other kind of tests. So you can reach out to them again on the number listed below here, or you can reach out through us as well. So these are the two companies I've listed here, but there are many more that we have been signing up with. So what you would see is that it's not just the readings that you would get, not only the peace of mind that you get by knowing of your parents' health data, but more importantly, you would also be able to act on it. For me, if I have to summarize, our solution is a simple, a robust solution to take care of your parents' health and to help you take data-driven decisions for your parents. And we are trying to do it on one connected ecosystem. So on one platform, you are getting not only the data of all the parameters, but also, you are also now able to sign up for additional services. And like I mentioned, this is available across the geography, 20 plus countries and more coming. And, I hope you will get incentivized to start using our solution to monitor your parents' health. With that being said, let me move into a Q&A. Pranati, Rahul, are there any questions for us?
Yeah, thanks, Sanjay. Thanks, Sanjay, Dr. Sanjay, and thanks, Vimal. I do have a couple of questions that came out through the Q&A, and actually some came through the chat. So, the first one is, are these any special devices? And, if we have the specifications, can we buy them online? So, Vimal, you may want to answer that.
Sure. So these are basically very standard devices, but only thing special about them is right now they are Bluetooth enabled. And we have integrated the devices from BPL and Roche, for our app right now. We are going to bring other devices as well, but for now, we suggest that you buy it through our solution, through our app, and when you sign up, you will get the options, and the offer we gave you is already discounted as well. So to answer in short, these are very special devices, very robust, tested by us, as well as they are Bluetooth enabled.
Thanks, Vimal. The next one is a little more on the medical side, Dr. Sanjay. Kind of what is really a stroke? I think we all hear about that, but maybe just a little bit of light on that.
Yeah. So stroke is when a part of your brain doesn't get the blood supply that it needs and therefore dies off. And it can happen because the blood vessel can get blocked and so the blood can't go, or the blood vessel can rupture and so the blood just gets out and is not flowing in the tube to that area of the brain. And different areas of the brain control different functions. So like one area could control movement on your left side of the body. So if that area dies off, then you get paralyzed on that side of the body. And then there's a region that controls your speech and language. And if that area dies off, then you lose the ability to speak. So similarly, this is how it affects your body. And this is what a stroke really is.
Thank you, Dr. Sanjay. I think there was one more question, and this was more a little bit more about the obesity that seems to happen with a lot of the folks in India. How is that related to the health condition? And will some of these parameters help there?
Yeah. So if people are overweight, they're at risk for heart disease and stroke and high blood pressure and those kinds of things. So that's in general. But what happens is that a lot of people get obesity around their abdomen, so around the stomach and the tummy. And so once that happens, it is connected with a medical condition called metabolic syndrome, which causes diabetes, type 2 diabetes, high blood pressure, heart disease, and strokes. And so one has to be careful, and therefore the keeping the weight in the proper range is really critically important for the health of the person.
Thank you, Dr. Singh. Vimal, the next one is to you. What happens in India? A lot of times the signal goes down, or the Wi-Fi signal goes down, or the network is not available. Uh, will the readings get lost?
A very good question, Rahul. No, the readings will not get lost. So the next time the phone is connected to the Wi-Fi or to the cell phone network, the readings actually get transmitted at that point of time. So they are not lost. If you have a poor network connection at your home, we still encourage you to go ahead and take the reading through the app, and it will get transmitted later on.
Okay. Thank you, Vimal. Question saying my parents are in Hyderabad, so can I actually, is this services available pan India?
Yes, yes. This is available not only pan-India, but in 20 plus countries as well, like I mentioned. So you can be anywhere in one of those countries. Uh, you can subscribe to the solution. The only thing I'll say is for their parents have to be in India at this point of time for you to subscribe the solution. Now, after you subscribe, they can travel with the devices to other countries. But it's available across pan-India, and we ship across India the devices.
That brings me to the next question. You mentioned that it's available in 20 plus countries. Does that mean that the families are in 20 plus countries, but all the elders using the apps are located in India? Or can elders outside of India use the app?
See, when you subscribe the solution, you have to give us an Indian address, and the parents have to be in India. Now, after they subscribe and they are using the solution, and let's say, my brother is in Australia and they want to move to Australia, they can take the devices with them, and they can continue to use it in Australia as well, as long as they have a way to get connected to the network there, and they can use it in those 20 plus countries. But we only ship devices in India right now.
So basically, what you are saying is that the physical shipping of the devices and setting up the solution is in India, but then the parents can continue to travel anywhere, and as
Mhm.
long as they are connected to the internet, they can take the readings and they will be available.
Absolutely. Yes. Thanks, Rahul.
Uh, Simpler question: do my parents have to take readings every day? And that probably, maybe Dr. Singh, you can answer that, or
Sure.
I think it's related a little more to the need to take readings.
Yeah, so it depends upon their medical condition. In some conditions, your physician may want them to take readings daily. In some, maybe once every other day or once a week. So it's something that you can discuss with the physician that is treating your parents or loved ones, and then you can decide on that and move forward. Obviously, the more regular you are in taking readings, the more data, good data your physicians will have to manage the condition, and you can monitor the health much more closely.
Um, I think that's it. I think, very participative. So I think we are right at the top of the half hour. So I will probably close that. There are no more questions, Vimal and Dr. Sanjay Singh, if you want to just close.
Sure. Well, thanks again to everyone for giving us the time over your weekend. And please feel free to reach out to us. Through it, we have a contact us form on our website, and you can reach out to us on that, or you can also reach out to us through the toll-free number that we have listed in the US or in India as well. So feel free to stay in touch, and we really hope that you will take the offer that we have given to you to subscribe to the solution for taking care of your parents. Thanks again, and have a wonderful rest of the weekend.
Thank you.
Okay, I'm closing the webinar now.